is John, the patient. He has just finished a consultation with Georgina, the pharmacist at the local pharmacy. They have finished talking through all the medicines John has been taking for diabetes. Both feeling quite content with the consultation, they go their separate ways to get on with their day. As Georgina walks away, she reflects on just how well the consultation went. She told him he must keep his blood glucose under control, otherwise he might get retinopathy and neuropathy. John didn't seem to question this, so he mustn't have been worried or concerned. She was glad she was quick enough to make sure she could get on with her other jobs. She told him all the side effects of his diabetes medicines, and definitely didn't miss anything out. She thinks she did a good job. She's good at talking to patients. After all, she is the expert, and it is just talking and giving information, isn't it? As John walks out of the pharmacy, he reflects on how well he believed the consultation went. John thought Georgina was nice, and he was glad she took the time to chat with him. On his way home, John goes to pick up his wife from work. As soon as his wife sits down in the car, she begins to ask John how his visit to the pharmacy went. John has a few moments to think, and realises that he didn't actually get much opportunity to speak in the consultation. His main worry about diabetes is that he might lose his eyesight. He wishes Georgina had asked him what he wanted to talk about, and what his concerns about his diabetes were. John remembers Georgina mentioned something about retinopathy, and although he knows it has something to do with the eyes, he isn't sure what that is. He still doesn't know if he will go blind. John tries to remember the information that Georgina gave him, but was too distracted by his own concerns about his eyesight, so has a hard time remembering whether to take his medicine with or without food. Maybe he didn't ask her to clarify things, because she seemed busy, and he didn't want to bother her. She didn't really ask if he had any questions anyway. He wishes Georgina had included him as a partner in the consultation, and given him more opportunities to ask questions, and for them to form a plan together. During the day, Georgina is reading an article about medicines and hospital admissions. She notes that 5% of all hospital admissions are medicines related. Between 1/3 and 1/2 of medicines prescribed for long-term conditions are not taken as recommended. 11 to 20% of hospitalisations for exacerbations are due to non-adherence. Georgina begins to worry about whether her consultation was actually good enough to help prevent John from becoming a statistic. She wonders what else she could have done better to make John the centre of his care, and ensure that they work together to improve his health and well-being. Georgina visits the Consultation Skills for Pharmacy Practice website and reads the Consultation Skills workbook and starts to reflect on her consultation skills. She can see there are some skills she demonstrates well, but there are some skills she needs to develop to be more patient-centred. Next time she will share the agenda and find out what John wants to discuss. Ask John if he has any concerns or worries. Find out what John already knows about his diabetes and medicines. Ask John what information would help him. Actively listen more. Treat John as an equal partner whilst discussing issues, options, and agreeing a plan. After completing the Consultation Skills programme, Georgina now practices with more confidence in her consultation skills, and has even started to apply the 4 E's model. She is now able to explore his concerns, educate John about what he wants to know and about using his medicine safely, empower him to make decisions about his medicine use, and enable him to take responsibility for his own health in an ongoing way. Do you want to improve your practice, like Georgina? Take a look at the Consultation Skills for Pharmacy Practice website today.